Hi, this is Shannon Riley, of the host of Backyard Pet Talk. Today, we will be talking with Dr. Rui Lobold from the Affordable Pet Labs, and I'm really excited to have Rory as a guest. This is something that's pretty new to the world of veterinary medicine, and so I'm really excited to have him explain all this to you. So, welcome.
Thanks for having me. This is going to be great.
Great. I'm super happy to have you here. So, because some people and a lot of people probably have never heard of Affordable Pet Labs since it's a fairly new-ish concept and you guys are a little bit revolutionary. I mean, and I think they're doing it some in humans and so now it's going to be available for animals. So, can you tell us a little bit about what Affordable Pet Labs does?
Yeah, happy to kind of walk you through it. So we've seen a lot in the last 5 to 7 years come up on the human space about sort of this quantified self and being able to do your own diagnostics and your own blood testing. And there's lots of home kits for blood testing for yourself, but that really hadn't existed on the veterinary side. So we were kind of limited to when you went in to visit your veterinarian, you could have diagnostic testing done, so blood work, urine, stool samples. In 2019, we formed Affordable Pet Labs really to address the access to diagnostics. So diagnostic testing has been the responsibility of veterinarians for the history of veterinary medicine, but we really wanted to open that up and improve the access to care, allow pet parents to sort of participate in that care and order testing and have the data and be able to share that with their veterinarian so that they could have a more proactive participation approach. And so we started Affordable Pet Labs in 2019, really with the vision of being able to send veterinary technicians to the home to collect blood samples or urine or stool samples, and then provide the test results back to the pet parents and their vet.
So say I have a cat or a dog and I'm concerned about something, whether it's maybe I'm concerned about cancer or I'm concerned about maybe a urinary, or maybe I just have my own sense. Can I just call and say, hey, I want these lab tests done? Or do they need to still see a veterinarian before they get these lab tests done?
They're both are reasonable approaches. We really see ourselves as sort of a facilitation of the veterinary relationship. And so if there's truly something going on with your pet, we recommend that a visit with your veterinarian happen. Like that's an important component. This isn't meant to be a replacement.
Mhm.
What Affordable Pet Labs is here for is we're here to provide kind of the routine wellness testing or the monitoring testing. So if you've got a 5, 6 year old dog and you just want to see how things are going, that's really what we're there for, is to be able to provide a full sort of battery of testing at home, right? Super easy to do. But if your pet is sick, we do recommend that you see a veterinarian or a telehealth provider, and then oftentimes they'll tell you what testing is recommended. If it's more urgent, then they certainly have the option to do it in the clinic or refer you somewhere, or we're available usually next day or within a day or two. We can get a team to your home.
So mostly it's prevention. And then if, say, I get my lab results and I have a vet appointment, do I just take those to into the vet, or does the vet have some kind of access digitally or something like that? How does that work?
Yeah, so for pet parents that have a veterinarian and have a relationship with a local vet that they work with, when we do the collection, we'll get that information. And when as soon as we have the results complete, we will send those results to their veterinarian as well. And one of the really neat things, because this is meant to be a wellness platform, one of the really neat things is that if you get that lab work before you go in, say for an annual exam, then when you go in to have the annual exam with your vet, you can sit down together and review the lab results right there. It's so much more meaningful to have something in hand that you can review at the time of exam, so they can also correlate it with the physical exam. You can talk through it. You get so much more value than a phone call 3 days later
Right.
that just says, hey, this lab work that you got, it looks fine. Right. This is just a much more detailed conversation because you can see the numbers and participate in that care.
Kind of like, some doctors will have you go to the lab before your appointment and then you can sit in. Veterinary medicine isn't set up that way where, you go in and go to, the lab and then the lab will send it. You're kind of creating that though by having affordable pets. You're sort of creating this way that they can have lab work done. And then if something shows up on the lab work, maybe that's concerning, maybe they look anemic or their white cells are high or something like that, then at that point they can talk to their vet and then have that discussion about what's next, and whether you guys do the testing or the in clinic does the testing, depends on the situation, I would assume.
Absolutely. And what our goal here is that the access to care problem has three major components. Cost is one piece of it. Physical accessibility is another component to it, and convenience is the third. And so, there are certain situations where it is just, you need to have it done at your veterinarian at the emergency hospital. There are those situations.
Mhm.
But for wellness testing or the semi-annual testing, it is so important. And we know this from the human side, right? It is so important to have annual testing, to have a baseline and to follow trends and see if the kidneys are struggling a little bit. You can see that for years ahead of time if you start to track the numbers. And so what we advocate for is having those regular touch points so you can share the data with your vet and then have a much more participatory discussion at or large dog that can't get in the car as easily has a more
Mhm.
convenient visit and less stressful in their own home.
That is true. And there are vets who do home visits too. So then they come to your home after, and like you said, the dog or cat got their blood work done a week or two before the appointment, and an in-home vet comes. Now, you said something about telemedicine. Do you guys provide anything about telemedicine, or is that just for other services that, because there are some veterinarians who are doing a little bit of telemedicine now. Is that something you provide, or is that something it's just different from Affordable Pets?
It's something different. So we're very clearly focused. Diagnostic testing is our lane. And so we see ourselves as the bridge between the veterinarian and the pet parent in many different facilities. So a telehealth provider may recommend blood work and they can call us to go out to perform the blood work. And then they can continue their assessment via telehealth because they don't have hands on. Mobile health, like you mentioned, mobile practitioners that go into the home, many of the veterinarians who refer to us are mobile practitioners, and so they are able to send us out 3 days beforehand, so we can get blood work before their annual visit or after the visit. So the telehealth is a really interesting growing area that I think is going to supplement the
Mhm.
traditional veterinary practice. We don't provide any of that. We're very clear that
Mhm.
our lane is diagnostics. That's what we're good at, and it's a pretty straightforward process. We send there's two sort of channels. We have blood work that we can do, and in any situation with blood work, we will send a pair of technicians to the home, and the pair of technicians will come. They'll meet your pet. They'll confirm the testing. They'll collect a blood sample. I mean, it's usually 5 to 10 minutes tops. It's very, very quick and low stress. The other channel is a kit, and we have kits that have everything you need to collect a urine sample or collect a stool sample and mail it back to us. And then those obviously we can do nationwide because we can ship them. But the technicians we have in 32 cities currently were available.
That's great. And I'm assuming that on your website, it tells you which cities those were available in. So if someone who's listening might say, oh, I wonder, that would be great for my dog or my cat. And they could just go to your website to see. Since I started talking to you guys a few months ago, that number in the cities has grown. So, it's a growing group of having those technicians available to collect the samples. So can they check on the website? Is that where you find out, or do they call to find out if there's a technician near them?
So both, we do have a current list on our website as it gets updated, and we're growing rapidly depending on where we have veterinarians who request our assistance in certain areas. So that's part of how we grow. We have other partners and employers that work with us in certain cities. So that's how we grow. So you can check our website. The amazing thing, if you go to our website, we've got a chat service. Everybody's got a chat now. Ours is
Mhm.
answered by a real human. So that's
That's nice.
a cool differentiator. So if you have a question, just ask. Or there's a phone number at the top of our website, and a real human will pick it up. So if you have questions, it's super easy to be able to jump on and say, "What do I need? Is this available?" Things like that.
So you do blood work and then urine and feces. So that would be obviously your technicians probably don't come in and do cell samples or skin samples or anything like that. Is it mostly just urine, feces, and blood? Are those your primarily what you're doing your labs on?
There is. We looked at it and said, how can we have the greatest impact and do it safely? So blood samples were obviously the greatest impact because you get so much value out of blood. It tells you about the organs, it tells you about bone marrow function and red blood cells and white blood cells and clotting. And we can do most testing that can be done in a veterinary clinic on the blood. So that's where we started, and that's probably 80 or 90% of our testing still. And then the other side of that is like stool samples. So if you live in an area with parasites, certainly checking for worms is a very common, very necessary thing. You should hopefully be doing at least twice a year or at least once a year, depending on where you live. We don't do any sampling of masses. Those again, this we're trying to improve the veterinary relationship, not
Not district. Yes,
so,
exactly.
if
Uh-huh.
there's a mass you're worried about, see your vet. Like that's important. Our founders are veterinarians. This is it's near and dear to us that we build that relationship up. And then things like ear swabs and things like that. We do offer those, but for the most part, because we're not going to be treating an ear infection, we want you to see your vet.
Right. You have about 30 to 33 cities. So with the urine and the feces, yeah, like you said, you have the kit and you mail it off. Do the technicians mail this lab or do they go to local labs to run the blood work that they collect?
So all the samples are shipped back to us at our Phoenix headquarters. So we have an office in Phoenix, and depending on what kind of sample it is and what needs to be processed, it'll be sent to the lab that is best suited for that sample. So there are certain universities which are established experts in certain types of testing. We partner with those universities or reference labs who are exceptional at doing that subset of testing. And then some of it we run in-house. So it really kind of depends on what kind of test it is. The rule for me as we started Affordable Pet Labs, I'm a veterinarian and a clinician, but I'm not a pathologist and a lab, operator. And so we set out to partner with labs that are very, very good at what they do, and we're very good at the client experience and having people in your home take good care of your pet and things like that. So all the samples come back to us in Phoenix, but then we get them to the labs that are established experts in their areas.
I was thinking as you were saying this too, we were talking about those mobile vets because that's becoming a little bit more popular than it was before. At least I'm in California and in this area, I think because it's expensive to have a office and, all of these things. So being mobile is becoming more popular. And this is a great way for those mobile vets to still be able to get all the testing or a majority of this testing done without having to have some of that in-house lab equipment, because you can, doing your CBC or some of those basic blood chemistries out these big machines, but then they could just have you guys do it and send it out, especially if they don't have a real office or something. And if they have limited technicians, because that's another part that the mobile vets sometimes have a hard time with personnel because they're driving around everywhere depending on the situations. If they don't have the van, some of them have the van that has everything in it in certain, surgical suites. But I can see this as a great way of collaboration. And do you do any work yet? And this might not be something that Affordable Labs does yet, but where you're in more remote areas, because sometimes I talk to people who, their vet is the closest vet is an hour away or something. And if you had a technician that was close, they don't have to go back to the vet twice to do the blood work and then do the appointment. They could just do that one time. Do you have any people in remote areas yet?
We do. We focused primarily on major metro areas just because
Mhm.
it's the easiest place for us to kind of establish enough work for our technicians to stay busy. I mean,
Right.
one of our missions, obviously, we want to provide exceptional pet care, but one of our missions is to create careers for veterinary technicians that are meaningful and pay really well. And as you may know, veterinary technician salaries are not the greatest. They do a lot of tough work and they don't have the best pay. And so that's something that we're aggressively aiming to change as we believe that's what drives the quality of medicine is good technicians. And so for us to be able to have a technician team that is in a major metro area and is fully booked, that allows us to pay them a very, very good salary that
Mhm.
is above most market in anything else they could do. And that was a meaningful thing for us. So staying in major metro areas, at least initially, that will change just because of
Mhm.
caseload.
And do your technicians typically do this as a full-time thing or just depending on, the need at the time?
Depends on the city. As we're launching new cities, they're part-time and usually they'll have another job at a clinic and then they'll work with us on their days off. And we encourage that. We want them to keep the rest of their clinical skills strong and their communication skills and working with clients and building relationships. That's an important part of the job. In some cities, like in Phoenix, we have plenty of patients, and so they work for us full time. And we create lots of opportunities for them to sort of set their schedule and have lots of work-life balance, which is and still make a good wage.
That is right. Now, another question that I don't know. So you'll now you guys do dogs and cats. If your technicians happen to be trained to be able to do like large animal, like maybe a horse or a bird, do you do any of that, or do you primarily just work on dogs and cats?
A little bit of a mixed bag. We're in Phoenix. We do a little bit of horse work because our technicians here are comfortable and it's close to the headquarters, so we're able to sort of try that. As you can imagine, working with exotic species and birds and horses it changes the skill set a little bit for our staff. And so we actually do a lot of fecal testing for like backyard birds and backyard cows and goats and sheep and things like that. So we actually do a lot of parasite testing, but in for blood testing, it's primarily just horses and only in Phoenix currently. That'll probably change in the future, but we want quality first and safety first. So we want to make sure we're doing it properly for the patient and for our staff.
If you have a bird and you just want to do those fecal tests, it's kind of hard to sometimes bring the animal in, or and if you can just scoop it up and then just take it, that's something that if it comes back positive for a parasite, then they can have that conversation, with their veterinarian and to get that treated. So that was something I didn't know that we talked about before. So that's really interesting. Now, as a veterinarian, and you're doing, this wonderful work of trying to have preventative care and have people paying more attention to the medicine up front, not waiting until they're really sick and snowballing. What would you recommend if you had the perfect world and, somebody's like, because some people love their animals and and they're getting a puppy and they're like, I want to do everything right. And obviously they're going to go to the vet for all their, vaccines and those kinds of things. But going forward, what would you say was a really good way of having the best wellness and, preventative medicine and wellness that you would recommend to somebody who might be listening who's like, oh, I really want to always know what's going on with my pet? What would you say? Once a year, twice a year? What would you sort of recommend as a recommended product?
Yeah, I think it's a good question because we think about this a lot of our goal is to maintain the happiest, healthiest pets as long as possible. That's sort of that longevity goal,
Mhm.
right? And we believe that data is a big component of that because if you can identify disease early, then that's the best way to try and treat it and head it off. So if we look at that in when we sort of build some plans around this, parasites are number one. Young animals have lots of parasites, and so can. And so it's something that monitoring stool samples for worms and other parasites, at least when they're puppies, and then on an annual basis at a minimum after that. So that's a really good sort of baseline.
Mhm.
The next level beyond that, and usually I'll start this before they're spayed or neutered when they're younger, and then on an annual basis is some basic blood work to look at, CBC, so red and white blood cells and platelets, and then a chemistry profile, basic kidney function, liver function, pancreas numbers, things like that, and that's basic blood testing. Certain parts of the country, you'll also want to look at infectious testing. So obviously, heartworm is a big one
Right.
that we all sort of think about because it's a good preventative. There's good preventatives for it. So testing is important, and doing that on an annual basis. Preventatives are good, but they're not perfect. So testing is a really good thing. And then tick fever and other things usually comes with that test. And so those are for me, that's kind of my baseline young adult or young dog or cat wellness. And in cats, I would also layer in the viral testing, feline leukemia, FIV, depending on lifestyle. As they get a little bit older, we start to look at that. We start to add urine in as a more frequent testing because there's so much information in urine that's really valuable. And at 3, 4, I start to add that in earlier if we need it for certain reasons. Cats, I usually will test urine earlier just because they have
Mhm.
more reasons to, especially male cats. And so I'll usually start testing male cats at about a year old. And again, that's an easy sample to collect. You put some plastic litter in the box and you collect the urine. That's pretty straightforward.
Mhm.
The typical baseline, getting a fecal once a year, I think is a really good idea. And then checking organ function with the chemistry and then the CBC to look at red and white blood cells and platelets. That's kind of an annual. And then at 4 or 5, I start to step that up and recommend it twice a year. Our headquarters is in Phoenix, so things like valley fever are prominent here. So we check that once a year, recommend checking it once a year. So to me, that's kind of the best thing. And then at usually about 5 or 6 years old, there's some really nice bloodborne cancer screenings that are available now. So we're starting to layer those in as dogs hit 5 or 6 or earlier, depending on the breed.
Yeah, and you brought up something that actually I think even just across the board would be so great if having the parasite disease like Lyme disease and Rocky Mountain fever and things that sometimes don't show up really obvious in, dogs and cats, they're lame or they're having some limping and they've done all these other testing and people forget sometimes that Lyme disease can cause, some lameness and joint pain. And so doing that as a regular heartworm people are becoming more aware of, but sometimes these tick diseases still haven't been, recognized as, depending what part of the country is, in California, it's not as known as Connecticut, everybody's will be testing for Lyme, but, so having those as preventatives, I think is great. And I'll ask you this too, because a lot of my clients are really seriously looking into insurance more these days, and when I first started practicing as a vet tech, there was like one insurance company and it was like, yeah, good luck getting them to cover anything. And it really wasn't always worth the cost. You'd spend all this money and then, your boxer got a mast cell and they were like, sorry, it's not covered. Or golden retriever had a large heart. Sorry, it's not covered. And so now there's too many insurance companies, I think, because I can't keep track of them all. Do these testings, if someone has an insurance company that does cover lab work, is this something that you can work together with an insurance company like they would at a in-house vet?
Yeah, so there's two pieces to that. A lot of insurance companies, we're actually in talks with several insurance companies about using the lab work that we're performing as sort of a pre-screening to help with premiums and the waiting periods and other things. So that can actually really help. But then the other side of that is our lab work is exactly the same as what was run at your vet. Like this is
Mhm.
the quality is the same or better that you'll find in most veterinary practices, just because we're using the same technology to do the testing. So oftentimes, insurance companies will cover our lab testing without an issue at all. Sometimes they'll want to see a veterinary recommendation that, hey, I did recommend this, or I think it was appropriate. But for the most part, the insurance companies will cover our labs. I would say generally our labs are 40 to 50% less expensive than having it done at a veterinarian anyhow. And so that offsets that even for those that don't cover. Some of them won't cover wellness testing, and I think that's where it gets probably a little
Excellent.
challenging if they're not going
Yeah.
to cover wellness testing. That's really what we're here for. Like we're here
Right.
to keep your pets healthy. And so that probably is the one area that they're not going to cover the annual cancer screening and, just because I want to see how my pet's doing.
Right. Yeah. I'm getting bombarded with clients bringing me different, policies and asking me, well, do you think this one's better or this one's better? And I'm like, I don't even know anymore. They're really complicated depending on what you need and what you can afford. And so, but I think that's great. And the fact that you are more affordable, which is in the name, it's more affordable so people can, because sometimes that happens, the vet says you need all of this lab work and it's overwhelming for some, clients who say, I can't afford, and then you're picking and choosing which lab work to do because of the cost. So if they can save some by going through you guys, that's another asset where the pet gets more and the pet gets to have you get the whole picture rather than just bits and pieces. I think that's a great thing for you guys too that you're providing.
And the insurance companies love it because we're helping to keep your pet healthy, which in the end helps them. And so they've been really excited about working with us. It's just, again, because it's a new model, everybody's trying to wrap their head around how it works.
Well, they're just getting used to, we're just starting to see the commercials for the human, colon testing and all the things you can do for humans. And even that is a little hard for people to wrap around where the doctor's not the one, doing the lab work or doing the testing. So, but we're getting to be a big population and there's only so many vets available at so many times. And if this can alleviate some of the overflow and then also get the pets cared for, it's a great solution, I think. So do you have any other last messages that you would want that, people to know about affordable pets or about how you got here, your passion, or any tips you would like just to kind of leave our audience with?
No, I mean, I think the big takeaway message for me is much like with us and with our health, that monitoring things is such an important piece. And whether that's us doing the monitoring or your vet doing the monitoring, we're really kind of our mission is to improve the overall acceptance of testing and frequency of testing in the US. How can we help as many pets as possible? And obviously, we're trying to be a conduit for that, but we're only in 30 cities or 32 cities now. Might be 33 by tomorrow, who knows? But for now, that's our footprint. But our message reaches obviously more people than what we can serve. And so what we want to be doing is we want to be encouraging the discussion with your vet or with us directly about how do we get the data to keep our pets healthy. I spent 10 years in emergency clinics across the US and as an emergency clinician. And the tough part is that so many of the diseases that we see come in on an emergent basis, I wouldn't say were preventable, but we probably could have avoided them ending in the ER and treated them better with more identification early and preventative care. And so our mission is if we can keep even just a few of those pets out of the ER with a terminal disease that could have been caught or could have been helped, that's
Mhm.
our goal. So my team is, like I said, a human will answer our chat and our phone. If you've got questions, even if we're not in your area, happy to help where we can. And obviously we're not your vet, but it's, we can answer a lot of questions.
Great. And if somebody wants to get testing, they can go to the website or we do get a lot of veterinary technicians because I'm a veterinary technician, so that follow and listen to the podcast, and because I talk to a lot of veterinarians on my podcast. So if either you wanted to get some testing done for your animal or look and see if you're in the area, or if maybe there's a technician that's like, hey, this might be an opportunity for me to do still what I love, but have the flexibility, or do some lab work, is all that information on your website?
There is. So there's three channels with that. The first one is for technicians. We're always looking for great techs that have years of experience in the field and have great patient skills and phlebotomy skills. I mean, that is what our company is built on, is good technical skills. So if you're interested in that, we're always expanding the areas we're in, and we're also expanding to new areas. And so there's information on our website for that. Veterinarians, we have lots of really good programs for vets. Probably 30% of our customers come from their vet directly. The other
Awesome.
70% don't have a vet. And so this is kind of a cool dichotomy there. And so if you're a veterinarian and you're interested, we have lots of really good programs where we will serve your pets on your behalf and get you the results and help with things like monitoring the hyperthyroid cat and the geriatric dog with, orthopedic disease. And so things like that can really help the vets sort of help their patients better, because now they're not dragging in the 100-pound dog that can't walk very well. But they're still getting the monitoring for the anti-inflammatory. So that's really cool. And then the third piece of that is rescues. We believe in giving back to the community as much as we can. And so for rescue organizations, we have huge programs to offer testing at cost. And so again, that's our commitment to give back to the community. There's information for all three of those things, as well as obviously pet parents who want to access testing. It's all on our website.
That's great. And we will have links all with this podcast so people can find you and find where you're at. And I think it's a great way. I work with a lot of fearful dogs and fearful cats. And so this is another way. Sometimes they're okay on the house, but that going to the vet is a very scary place. And maybe they can handle the exam, but they can't handle the poking and the prodding part of it. So, but maybe they would be okay if they were in the house, in their own home. So think you're providing a wonderful service, and hopefully you start growing and you're in all the states and all the, major cities eventually. You can help a lot of pets this way. And so I hope everybody checks out Affordable Pet Labs. And like I said, we'll have the links. And thank you so much, Rory, for being here with us today and explaining this new concept, your revolutionary concept for veterinary medicine, and hoping to help veterinary medicine, because I've had other vets on the podcast that have also explained that, that's one of their hard things, is the wait list, is so long. And if they don't have to come in for lab work and they're just seeing them for appointments and the lab work's already there, maybe that can make up some more space for them to see more pets too. So, well, thank you so much for being here, and check out Affordable Pet Labs and share all this for you. And then we'll see you on the next podcast. Thank you,
Sounds good.
Rory.
Thanks.